guys for coming. Welcome to the second year, fourth semester guidelines. Um, I think you had histo this last winter. I hope it went well. I know there were a lot of difficulties kind of getting examination dates for histo, and we spoke with the department. I hope everyone managed to get their attempts in order. But today we're going to be focusing on what's to come for the next semester, and so yeah, we'll just get right in. So introducing the team for this year is going to be myself, Johannes, and Hiroko. If you have any questions for us throughout the semester, feel free to message any one of us privately or the MIMSA team in general, and we'll get sure we can make sure you get your questions sorted out. Um, so yeah, first of all, Hiroko, did you want to? You're better at explaining this than I am. This is the kind of completion types that we have. And I think Hiroko will explain what kind of exam completions you have on the IS.
Hi guys, so this is just a little tip for you guys so that when you're in the IS and when you have a new semester coming up, so that you can look at your courses and you can figure out what kind of completion is needed in order to finish the course, like whether it's an exam or whether it's just credit or whether you don't have to do anything at all, for example, or whether you might not have to do anything at all. So basically, we only have 3 types of courses. We have courses that are indicated by ZK, courses that are indicated by K, and courses that are indicated by Z. In order to see this, you go into the IS, go into your student to see your courses, then go ahead and select a course. You should see next to the name of the course on the right, something sort of similar to this image in the little red box here, where it shows the number of credits, and right next to it, there will be like a 1 or 2 letter designation. So like I said earlier, we have the 3 completion types, and they're actually abbreviations for check words. So I guess arguably, if you care about grades, the most important one is going to be ZK. So anytime you see a course that is designated with ZK, this means that the course will end in that semester with an examination, and you will get a letter grade evaluation. Typically, these exams are going to be a complex of examinations where you have several parts. Usually there's a written and an oral part. Sometimes you may have some sort of a practical or theoretical portion where you may have to demonstrate some skills if it's applicable. So of course, you guys know that the grades that A through E is passing and F or a dash is a fail. In case you guys didn't know, a dash is given anytime you fail to show up for an examination. So if, for example, you fail to take your first attempt during examinations period because you decide that you want to take the exam during the next examinations period, you should get a dash, but it's the equivalent of an F. So the next completion type is going to be a K, which is a colloquium. And this is another type of examination, but instead of getting a letter grade, you're going to just get a pass or a fail. So in the IS, you would see a P for pass or an N for fail. This type of examination is actually quite variable. You may have to do some sort of group project, or there could be just a written examination, or it could be an essay or some sort of demonstration of skills. It's completely up to the department what they want to do with this type of exam. And the final completion type is going to be a Z, which is just according to fulfillment of requirements. Usually this is going to be either attendance, but for example, in some other courses, there could be like a written credit test or something. Or sometimes, you know, in the case of lectures, attendance isn't even mandatory. So you just receive the credit for that.
All right, cool. I also just, if you guys have any questions, use the comment section, we'll get to it. And yeah, so this is what you need to worry about this semester. Majority of it, unfortunately, is exams. Your biochemistry exam, your physio exam, a couple of credit tests here and there. You'll have physio tests. I believe they're online, so you're kind of lucky in that aspect of things. But what are the other things you need to worry about? You know, the small credit test and the chemical safety report. I think it's online. That shouldn't be too much of an issue. In fact, that should be a little bit of a smaller proportion on the pie chart. And of course, the nursing internship, if you haven't already done it last semester, I know the year is split into 2. with that. So if you haven't done it last semester, you would definitely do it this semester. Hopefully earlier than later. I think it's good to get that out of the way. These are the main exams. It's annoying, but it's always in the way, and it's always nice to get that done first, so you can focus on the big exams for this semester, which will be biochem and physio, which is, that's the reason why it's notoriously known, I guess, as the semester of death this semester. Like I mentioned before, what else do you need to worry about? The credit tests, the theoretical basis. Microbiology, you have credit tests at the end of the semester. It's not too much of an issue. And chemical safety and nursing, it's not going to be a problem whatsoever. So yeah, moving on to prerequisites. Yeah, Hiroko, you want to take over?
Yeah, so you'll find that as you progress through your studies here at the university, that the prerequisites actually become increasingly complex. So this is no exception. Already starting from second year, the prerequisites for future coursework becomes kind of like a bit of a maze, or rather like a bit of a labyrinth, and you're going to have to really keep track of what you're passing and what you need in order to stay on track. So of course, let me just go ahead and get this out of the way. In case you are an anatomy repeat, I think it is worth mentioning that you are absolutely required to pass the anatomy exam during this examinations period in the summer. You cannot wait until the winter. You will be expelled if you have not passed it during this examinations period. And I would also like to remind you that if you are a repeat student for anatomy, that you only have 2 attempts for the examinations period. So just once again, a reminder that if you have not yet passed anatomy and you are a repeat student, that if you do not pass anatomy during the summer examinations period, you will be expelled from the university. And if you want to continue your studies, you will have to go through the entire admissions process again, and you will, including the entrance exam, and you will have to re-register for everything again. So just a warning to you guys, if you are a repeat, that is your absolutely, I mean, this is your priority. You absolutely need to finish anatomy. For those of you who are repeats in anatomy, we would like to give you guys some advice, because obviously you have some monster exams this examinations period. You have biochem and physio, which are pretty big exams, and anatomy is also a really large exam in itself. And in the event that you're unfortunate enough to also have histology, we probably recommend that you ask the study department nicely to hello?
I think we can hear you, but yeah, keep going.
I'm sorry, what was the last thing that you heard?
Study office, go to the study office if you still have anatomy, histology, physio, and biochem.
Oh, thank you. Yes, rather, we would like to ask you if you have anatomy, especially if you have anatomy and histology, to go ahead and consider possibly asking the study office to unenroll you from physiology. Because oftentimes what happens is students are so stressed out by anatomy and histology that they are unable to study for physiology properly. And either they go to their first attempt in physiology completely unprepared, or they don't go at all, in which case they lose an attempt anyway. So it's really, really, really worth considering. If you think that you're capable and you're able to handle doing all of the exams this period, then by all means, that's up to your discretion. But we definitely recommend that you, if you cannot handle it, or if you think that you cannot handle it, that you probably should try and ask the study office to unenroll you from physiology. I see that there is someone raised their hand.
Yes, I was just wondering, do you know the due date for when you can unenroll from courses and stuff like that? Is there a specific date?
I can actually add to that. It is still possible today, but today is the last day as far as I know, so Sunday 14th. You're still able to unenroll from physiology as of now. But in case it doesn't work, again, a friendly email to the study department helps, and usually they understand the situation and will accommodate you. But I'd rather, like, if you're considering unenrolling from physiology, I'd do it as soon as possible. What I'd like to add to what Hiroko said is also the fact that even if you still keep physiology and biochemistry this examination period and have anatomy in the summer, you can theoretically take 2 attempts in the winter afterwards. But the number of people that are able to take both exams in that examination period again is not particularly big. So if you do not manage to take any attempts at physiology at all during the next year, you will go to your first attempt for physiology a year after, but only with 2 attempts left. And this is the crux. Going to physiology with only 2 attempts before being expelled makes life a lot harder. So yes, I would take this recommendation to heart. And if you are still studying anatomy and have histology as well, then I would take this into consideration.
I would also like to add one more thing, because oftentimes students bite off a little bit more than they can chew. And it's just to sort of emphasize how difficult it is to pass all of these exams in one examinations period. When you have histology, anatomy, biochemistry, and physiology, it is almost impossible to pass all 4 of these exams. As far as we know, there have only been 5 students in 5 years that have actually managed to pass all of these exams in one examinations period. So that is why we are asking you to kind of consider your situation, to be realistic. If you think that you're able to work hard, that you're able to find that motivation, you're able to stay on track, stay organized, have good time management, and do it, then by all means, that is your decision. But just to emphasize that there have been hundreds of students in the last 5 years, and only 5 students have managed to actually pass all of these exams in one examination period. So that's just to illustrate how difficult it is to do all of these exams in one examinations period. And of course, like Johannes said as well, if you don't do the physiology examination this examinations period, you will also automatically lose an attempt, and you will only have 2 for the next time you go and actually take your first attempt. So again, anatomy is a huge exam, and if you still have that, to go ahead and consider how much you have left. Of course, we already kind of briefly mentioned histology, but in case you still have histology, histology is a prerequisite for pathology. So try your best to finish histology this semester, because pathology, at least, it's actually a pretty fun course. So it's a nice insight into clinical studies. So I definitely recommend, if you have histology, to also go ahead and get that out of the way. And I see that there is a hand being raised again.
Yes, I was just wondering, what is physiology prerequisite for again?
I will actually get to that next. So physiology, actually, so biochemistry and physiology are actually 2 very important courses for the remainder of your preclinical work, but obviously this sort of, I guess it creates a bit of a snowball effect. So the thing is that if you start falling behind during the semester and you're unable to pass biochemistry or physiology, you will actually find yourself falling farther, well, not necessarily falling farther and farther behind, but you will find that you will be, because I'm sorry, to backtrack a tiny bit, the prerequisites here at the university are a little bit strange. So you will find that you may be able to take some clinical courses, but the majority of them will be blocked for you. So definitely, obviously, physiology and biochemistry are probably the 2 biggest exams that you need to stay on track for clinical years. But in any case, if you still have anatomy and histology, then those are far more important to take care of than physiology and biochemistry right now. So just to kind of continue. So in order to enroll in immunology for the 5th semester, you need both physiology 2 and biochemistry 2. You need to complete the lectures, practice, and seminars for both of these. However, immunology is not really that big of a roadblock, because you're able to take it the next year, and I don't really think that it interferes very much with clinical studies, but I'm sorry, I'm not too sure about that. And in order to enroll into microbiology 2 lecture, just the lecture, you need to have both biochemistry 2 and microbiology 1 practice. For some reason, in order to enroll in Microbiology 2 practice, you only need Microbiology 1 practice. You don't need biochemistry for this. However, if you can, it's really advisable to go ahead and take the practice, like Microbiology 1 practice and lecture at the same time, because what happens is that sometimes students took the Microbiology 2 practice, but they haven't taken the lecture, and the topics are obviously related. And what ends up happening is that they take the lecture like a year later and they don't really remember much from the practice either. So that's just to remind you, because the final examination of Microbiology 2 requires the practical portion as well. So if you've taken them a year apart, obviously it's quite difficult to remember the material that you took in the practice 1 year before. So
also, Hiroko, sorry, I'd like to quickly add, guys, don't worry about jotting down all this information. We'll plug in a little handout that we created, that Hiroko created at the end of the thing. It's got all the information that you possibly need for the rest of the semester. Everything we're saying now will be in that handout, so don't worry about taking down any notes. So I'll link it in the comment section soon.
thank you,
Yeah,
Ashwin.
continue.
So, and then moving on. So in order to enroll in Pathophysiology 1 for the 5th semester, you will need either Physiology 2 or Biochemistry 2. However, beware, because Pathophysiology 2, which is in the 6th semester, requires both Physiology 2 and Biochemistry 2. So again, kind of going back to what happens with students often, sometimes it happens that students don't pass Physiology 2, and they end up as a repeat student, and what ends up happening is that they're cut off from pathophysiology for a year again. So it's not that it's impossible to do it this way, it's just that it's a bit more difficult to keep track of coursework when you have courses that are interrupted with a year of studies in between, and you have to go ahead and like go back and refresh everything from the from the semester that you did a year before to catch up for the second part of the semester. And the final prerequisite I would like to mention is that in case you don't pass check 4, this will preclude enrollment into check 5, but that's not really a huge deal. In case you guys don't know, you actually have 8 semesters of check, so not passing check right now is not really a big deal, but of course it's kind of annoying, so just go ahead and get that out of the way if you can. Okay, so moving on, I will actually start with check. So for this semester, I believe that you guys have probably seen, because you guys should probably have some interactive syllabi on the IS. So you guys have a total of 2 progress tests, and instead of having a 3rd progress test, you actually have a, I'm so sorry. Okay, I'm sorry. Instead of having a 3rd progress test, you guys will have a class project instead. I believe the details for the project will be given to you by your respective instructors. So you guys get the same deal this semester as you guys have had in the previous semesters. If you pass the progress tests, the pass mark is 70% on these progress tests. Then you can go ahead and receive a 2-point reduction. Well, actually, I'm sorry. Excuse me. You have 1 written and 1 oral progress test. The written test is going to be done online, and this is a 2% reduction if you pass it on your final exam for the written part. And for the oral test, that's actually 3% reduction. And the class project will be another 3% reduction, which totals to possibly up to 10 points reducted from the final exam, so that the pass mark on the written part of the final exam becomes 60% instead of 70%. You guys all also have homeworks given throughout the semester. I believe you should have weekly homeworks. It can be given in the form of robots, or you can have some handouts that you have to upload to the homework vault, and textbook exercises, which also I've noticed what they've been doing is they've been scanning the books, and you go ahead and upload those to the homework vault as well. These need to be turned in within 7 days of the assigned date, and if you do over 90% of the homeworks, then you will get another 2% reduction on your final exam. So as far as books and materials go, nothing has changed from last semester. You will still be using the check step-by-step books and the workbooks, and you will also be using Talking Medicine. You will be using a lot more Talking Medicine than you will the step-by-step books. And for the final examination, for the final examination, you will have a written and an oral portion. Just to remind you guys that final examinations in Czech are always going to be cumulative, which means that you are not going to be tested only on the material that you had that semester. You can be tested on anything that was covered in any of the previous semesters. So that includes Czech 1, Czech 2, Czech 3, and now Czech 4. So just beware, because sometimes students aren't aware of this and they try and complain because they go, oh, well, that was vocabulary from Czech 1, and actually it's fair game. So just to remind you guys that it is a cumulative exam, and they are always cumulative exams. So that's it.
Also, I think it's safe to say that we all think that Czech 4 is the hardest Czech, right? I would say so. And after Czech 4, it's pretty much downhill. So I think it's good news if you get Czech 4 done quite early as well.
I'm sorry,
right?
I wasn't.
Think?
Is it?
Yeah,
maybe
I think it's a general consensus that it's the hardest one.
Yes, there's like the Czech department has told us that as well. So not quite sure if it's true, but yeah, they have told us that at least.
I think is that there's quite a bit of material that they expect you to learn from this year. So yeah, it probably is quite demanding. Yeah, I don't actually remember what we do in each individual semester, so I'm not really sure I can comment on whether it was harder or not. I don't remember. So, but if you guys say so, then I believe you. Okay, so and then of course just a little reminder here that if you don't pass Czech 4, that you can't go into Czech 5. Okay. So next, clinical introduction 1. So this is a new course for you guys. I would like to mention that this course kind of has a bit of a strange structure. It's actually divided into a lecture and a practice, but they have nothing to do with each other. And maybe I shouldn't say it this way, because technically everything that you learn in this course is supposed to be preparation for the clinical studies. But I just wanted to mention that the lecture, you've probably realized already, is not organized by the same people who organize the practice. The practices are rather, the first practice, and only the first practice, is going to be organized by the biochemistry department. And so what that means is that all of the materials that you need for the practice are going to be in the IS. They're going to give you the recommended, they'll give you like PDFs with like the recommended reading, and then you'll have protocols that you need to complete. Just to let you guys know that because the material from clinical introduction practice, the first practice, because it's run by the biochemistry department, what that means is that any of the material from Biochemistry 1, Biochemistry 2, and the seminars and practices is actually fair game to ask in Clinical Introduction 1. So in case you find that you're doing the protocols and you can't figure out where the information is supposed to be coming from, I really highly recommend that you go to the IS and check the study materials for Biochemistry 1 and Biochemistry 2, because the answer is very likely within those materials. So like I said, practice 1 is run by the biochemistry department, but practices 2 and 3 will actually be organized by the clinical departments, and they'll be taught in the faculty hospitals. There is only one lecture. So actually, you don't really need to worry about it. There is no exam or anything like this in the lecture, but you will have an exam at the end of the third practice. And even though that seems kind of far away, I just wanted to give you guys a heads up that this is a consecutive course with 3 semesters, and that at the very end of it, you will have an exam. Although I cannot speak from experience with the exam itself, because when Ashwin and I had the course, that was last year, and it was at the beginning of the pandemic. So we didn't have the exam in the way that it was supposed to be structured. We were actually just told to write essays, I believe. Yeah, that's what we did. But I think that what they had told us before is that when you have the clinical 3 exam, that it will be based on like physical examination and history taking. So maybe not so much to do with content from the first practice, but just to give you guys a heads up. Anyway.
It's actually a lot more fun than you think.
I'm sorry?
Sorry to interrupt you. I was saying it's actually a lot more fun than I thought it was going to be, especially whatever we managed to do in the practice. Like it was finally, after like 3 years of learning all this dry information, you finally get to put it to use. They make you think about it, and you get to do some diagnosis. It's actually like I think one of the first few times in this course, in this medical course, I felt like oh wow, I'm actually doing something. So yeah.
Oh yeah, I definitely agree with you. Yeah, by the time you get to the second practice, so like I said, this will be taught in the faculty hospitals. You actually get to like see some patients, and you get to learn about examinations, and you actually get to like touch patients and stuff like this, listen to their heart and lungs and stuff like this. It's actually a lot of fun, and it starts feeling like, oh yay, finally we're actually doing something. So it's quite fun. So I'm excited for you guys that you guys hopefully by the time you guys are in the next semester, hopefully this pandemic will have calmed down a bit, and you'll have the full experience in the hospitals the way that we did. So
yeah.
So you guys should know already that in the practice you have protocols that you need to go ahead and fill out and upload to the homework vault. Materials, again, any of the materials that you need for the practice are going to be found within the IS study materials. The lecture would just be if they have uploaded lectures. I don't know how the course is structured, but when we had it, they didn't upload lectures for us, and there was no recommended reading. So but in any case, there's no exam for that anyway. So it's up to you whether you want to study for that or not, let's just say. Okay, again, I had already mentioned that any materials from the biochemistry 1 and 2 are also fair game. And then at the end of the semester, you will have a credit test. According to, I do not know the current conditions for the credit test, but according to the IS, you need to get 9 points on the credit test. I don't know out of how many. So I'm sorry, guys, I apologize for not having enough information on that, but you will have a credit test in the practice at the end of the semester. So just to let you guys know. Okay, and the last course that I'll be covering for now before I switch off will be a theoretical basis of clinical medicine. This is yet another course which is consecutive. You will have 4 of them total, but these are basically somewhat, I mean, if you ask me, they're somewhat random compilations of lectures. They don't really seem to have like a very common theme. So I believe they're probably still doing it the same way. They did change the 4th course for us, but I believe that for you guys, it should still be various topics given by various guest lecturers from various departments. So at the end of this course, you will have a credit test. And the credit test will be based on the lectures, the content of the lectures, and maybe some additional information, like some knowledge from subjects that you should already have taken. So, but it's really not a difficult credit test. There was a 100% completion rate in spring 2020. So it should really not be an issue for you guys at all. So I will go ahead now and I will switch off to Janis, who will take care of medical microbiology.
Yes, so hello everyone. I'm gonna add on just a couple of things to biochemistry because we're going to be discussing that as well. Biochemistry and introduction to clinical medicine are clearly linked, and the knowledge that you get from introduction to clinical medicine it actually plays nicely into your biochemistry exams. So knowing these 2 subjects for your final is actually quite helpful. But for now, I'm going to continue with medical microbiology. Medical microbiology this semester is not something that you have to worry about. It is something that you have to fulfill the course requirements in order to get your credits. But besides attending to your classes and filling in reports, that shouldn't be too big of an ask. The course at the moment consists of lectures and practices. The lectures are held on the online, and practices are held at the moment bi-weekly as a concession from the microbiology department to us to reduce class size. For the practices, the only thing you need to make sure of is print out your protocols, take them to the class, and do your robots before you go to the class. It doesn't make that big of a difference, but you will get an additional point in the credit test at the end of the semester when you complete all your robots in time. And Andrei Zaradnicek, the teacher, he checks regularly during the semester whether people actually completed the robots. And once you get to the credit test at the end of the semester, he's going to be like, yes, you'll get an additional point. And that actually helps out a couple of students. The credit test at the end of the semester, it is not that big of a deal in general, as long as you at least paid some attention during the practices. The credit test should be more or less fine. When it comes to books and materials, studying for microbiology this semester, people tend to neglect it in favor of biochemistry and physiology. However, if you do decide to study, It's a software, or there's an online program called Sketchy, which I cannot recommend enough, especially when you get to the final for microbiology in the coming year. I tried to study without Sketchy because I am very much a person that likes to read through a textbook, take notes and everything. And after probably trying to do this for a month, I realized there's no way I'm going to get through all of the information, and I turned to Sketchy. And it is a completely different style of revision than I'm used to, because normally I revise things with flashcards and everything, but I realized that this is literally the only way that you're able to pass the subject, and it is the best way to pass the subject. So I had my exam a couple of weeks ago, and that went perfectly fine. So microbiology in itself, this semester, nothing to worry about, and in the coming semester, you're going to have plenty of time on your hand to take care of it. Next up, biochemistry. This is one of the more important ones this semester, actually probably the most important ones. If you pass biochemistry and do not pass physiology, technically you will still be on track. You will not lose a year, so that's the good news. Biochemistry consists of lectures, practices, and seminar. Practices are held in laboratories at the moment, which is nice. I only had 2 lab sessions before the pandemic started off, which is kind of a pity. And seminars currently held online. For the seminars this semester, it's going to be a lot more interesting. The reason why physiology is a prerequisite for biochemistry 2 is because now the second semester has a lot more clinical relevance to it. The first semester, you're going through cycles and like metabolic pathways. The second semester, you're starting to learn about the clinical implications, all of this. And this links in very nicely with clinical introduction. So in biochemistry, you might be studying acid-base balance. In a clinical introduction, you might be studying the clinical features, the lab data that you might be seeing. It usually syncs up quite nicely, these 2 subjects. Yes, books and materials. You should base your revision similarly to anatomy on what the faculty provides. And the biochemistry department actually provides one of the best resources in all of the departments. Basically, all of the things that you need to know for your biochemistry final can be found in the lectures. The lectures, if you download the PowerPoint presentation, they have small notes section at the bottom. And I'm guessing you already found them last semester, but in case you didn't. And all the information that you need to know for the final exam can be found in the lectures. Now, this is not absolute. For some topics, it is helpful to consult other materials, and there is textbooks in biochemistry which can augment your studies. But if you understand and know the lectures well, you will be fine for the final examination. The final examination, also a lucky change thanks to COVID, does not have a written examination anymore. You will automatically go to the oral exam, and you will pull I think 3 questions for the exam. And you will be discussing it with your examiner. For the exam, it is crucial to know everything from the first semester. And during the semester, I would already start revising what you completed during the first semester. It is, I think, crucial to remember all the important cycles, and it is also crucial to remember how to draw the most important of them. If you're not able to draw the structures, for example, of the citric acid cycle, of glycolysis, of fatty acid synthase, if the examiner asks you to do it and you're not able to provide, this will be a reason for failure. So there are very helpful diagrams that can be found online, and I might add a very helpful scheme to the study hub later on that basically has all the cellular pathways that occur in the human body that are important to know, with all the names and all the structures in it. And when you start to memorize how to draw it, it'll help you for your final. Biochemistry is a subject that is important to understand more than to memorize. And it helps for that to learn the basics of chemistry as well. If you know what a functional group is, if you're looking at a chemical molecule, it is like important that you're able to point out, okay, this is a carboxylic acid, this is an alcohol group. It just helps you to understand the core of the subject a little bit more. So biochemistry is one of the subjects where it helps to not skimp on the details, I think. And last but not least, we have the handling of chemical substances.
Sorry, Johannes, sorry for interrupting you. Quickly to add in for biochemistry, I just want to emphasize how important the lectures and the notes underneath the slides are. Like Johannes said, those lectures and those notes under the slides are just as important for the biochem exam as the white books were for the anatomy exam. So they really want you to know whatever's in there. And obviously, like Johanna said, there's some things that you won't be able to understand from the slides. So use external sources such as books and videos. For example, like Ninja Nerd Science on YouTube. That's pretty much exclusively all I used for a while. So it's kind of perfect for that. So yeah, that's all I wanted to say.
Okay, handling of chemical substances. Handling of chemical substances. Nobody really talks about it in the biochemistry department, and most people actually just took the robot just before the end of the examination season. The robot can be taken as often as you like, I think, actually, and it is basically. I do recommend reading through the chemical safety guidelines before your practices, before your laboratory practices, because yes, you will be handling with moderately dangerous chemicals, but nothing out of the ordinary. So read through it, understand what you're doing, behave safely during the practices, and then you'll be fine. And yes, those materials should be sufficient to answer the robot, and you can basically take it anytime you like. You can take it as often as you like. And I think that is it from me for now. Now I'm going to hand over to Ashwin.
All right, so physiology, by far one of the biggest subjects that you'll do in Masaryk. I'd say in quite close to anatomy in terms of size and in terms of how much knowledge you need to know. And the specification you have is very good. But the thing is, it's not specific, unlike what the name suggests. The thing is about physio, there is no kind of limit as to what you need to know. So you don't really need to know. So it's impossible to know what you need for the exam itself. Like how much do you need to understand? Where do I stop? How much of this chapter do I read? Like, you know, the amount of depth of knowledge that you need to know is quite difficult to understand. So I think the key for physiology is to pick a couple of sources that you like. And it really depends on each person, and stick to those sources, make sure you understand the basics, and kind of get the exam done that way. As you already know, there's a lecture, practice, and a seminar for physiology. The lectures obviously will be online, and I'm not sure if the rest of the practices, or I think, but it's necessary for you to have full attendance and make sure you participate in all the protocols and the credit tests you have throughout the semester. But yeah, books and materials. Now, this is a bit of a sticky subject in a way. There's so many books. There's so much information for physio. It's really I empathize that people get lost in all the information and don't know what to study from. My advice is pick one or two. I know that some books are better for some chapters. I don't know about Johannes and Hiroko, but for me, the best book for me personally was Costanzo. It was nice and small. I read most of the chapters in there for my final examination, and I think the key really is to not look at it as like a massive mountain to climb. Just take it step by step. Just read the first couple of chapters, and then you kind of get into it. And it's daunting to look at the entire book. For example, the department itself recommends boron, and you guys have seen boron, or if you haven't, you know how it's quite impossible to imagine how thick it is, and it's definitely daunting. But it is for some people really do enjoy boron. It's a nice read as well. I don't think I can say the same for Ganongs though. I read it a couple of times and it's quite impossible to get into. So it really depends on preference, the sources that you pick for books and materials. But I believe the department also has some of their own materials, but they definitely do recommend boron, the big white one. And obviously there's practical white books that you'll be using throughout the practices during the semester. I'm not sure if you guys have that in person, but you definitely have the books, or if not the PDF version. You will need that for the final. Like I said, for the final examination, oh, actually I haven't mentioned it yet. So the final examination for you guys, lucky you, you will not have a written, which is really lucky, I have to say, because the written for the physiology is arguably the hardest written. I don't know if the other two agree. It certainly was the case for me. You have to spend a lot of time thinking about each question, all the different options for each question of the written, really made you think. So I think, but they will definitely like, you know, it's not necessarily easier for you, because I do think they'll expect the same amount of information in the oral examinations, which actually is the hardest part of the examination. And in the oral exam, you have 4 questions. One of them will be based on the practicals that you'll be doing throughout the semester. So you get one practice question, maybe like measuring blood pressure or something like that, or ambulate. I think ECG maybe is another one, measuring ECG values. So it's important to go through the practice white books for that. There's nothing else you really need. Maybe some videos on YouTube just to see how the procedures are done, because many of you might not have been able to do it in person. And of course, the other 3 questions will be based on the other information given to you. Study tips. As you know, physiology is about understanding. The more you understand, the better you're going to be prepared for the final exam. It's not about memorizing. I can't stress this enough. Physiology, you don't memorize. You really don't memorize. Maybe some numbers here and there, some schemes you can memorize, but physiology, I can't stress enough. The more you understand the basics, it's impossible to fail. The examiners will not fail you if you understand the basics really well and you're able to explain it to another person. Oh, and that reminds me, physiology is a really good subject to study with other people, because you can explain it to each other. And when you're listening to someone else explain to you like a certain process, or like certain like schemes or whatever, like you'll be able to pick up things that you didn't pick up yourself from studying on your own and repeating the subject on your own. So I really think it's about active listening and active learning. So that makes the biggest difference with physiology. Also, majority, if not all, of the physiology department is full of cardiologists. They really like cardiology. If you get a heart question and you don't know enough, they're definitely going to fail you. Please, please, please definitely do cardiology really well. We've already covered cardiology on the MIMSA YouTube page. Please check that out. We've done some videos on it. I did electrocardiophysiology last year, and Hussein was our previous in the previous MIMSA team covered the rest of the cardiology. So let us know. Maybe we can update it if you want. So let us know how that works. And yeah, so and the lectures that are provided to you throughout the year are pretty useless if you're going to look at them on its own. As you know, most of them are just pictures and schemes. You're going to need the recording of the teacher to explain through the different pictures and schemes. Their explanation is the main reason why you should go to the lectures in person. If not, if they're recorded, maybe listen to them later. And obviously, we're going to be doing the physiology lectures. I want to plug today, later on at 3 on this very MS Teams. Johannes is going to be doing renal physiology, covering renal physiology. I know you guys have a test coming up on that, so I highly suggest that you go to it. In fact, I'm really confident that everyone will find that useful. So yeah, definitely attend that. It'll be a really good lecture. And yeah, so I talked about the Feynman's technique. I think that's what you call teaching each other with friends. But yeah, sorry, do you want to say anything?
Yes, I just wanted to add one thing to the final examination. I'm third year now, so I took my physiology exam last summer. I actually didn't have it written, so I can't comment on that either. But what I did take away from the examination is I cannot stress how important your physiology practices are. You're going to start your examination. The first question they're going to start asking you is about the practice. And when I took my examination, probably half the time of my exam was actually discussing the practice, and not just discussing the procedure, but also discussing what you measure, why you measure it, what would the implication be if some like parameter change. Like understanding the practices in fair detail, or like in a good amount of detail, is absolutely crucial. And especially practices, for example, in pulmonology, where you have to draw a lot of, or like we have to look at a lot of graphs and schemes. It is definitely recommended that you understand what these graphs mean, that you're able to sketch a couple of them. And the examiners very much like to see that. If you do not nail the practice question off the start, the examiner might not let you continue. So it is absolutely crucial that you pay attention to your practices, that you take away what they want during those practices and that you know them well for your final. I just wanted to add that.
Yep.
If I may
Yeah.
add something as well.
Yeah, go ahead, Eureka.
Okay, I would like to emphasize the fact that unlike in first year, where you could get away with rote memorization and just sort of just spitting out information, that will not work in second year. I will emphasize now that understanding is much more like, well, basically for biochemistry and physio, understanding is much more valuable than memorizing, because the examiners really, really, really like to dig. They like to see how well you understand the basics. And it sounds insane, but a lot of times when you hear students complaining about exams and how they failed, a lot of times they're saying, well, you know, I said all of this stuff and then they said I failed and it was unfair and all these things. But the reality is that these examiners, especially when it sounds like you've been rehearsing a very like complex topic, they start to really dig at you. Like, let's say you have EKG, then they start to ask, okay, well, what's the difference between a unipolar and a bipolar electrode, or things like this. And if you're unable to answer these really basic questions, it is grounds for failure. And it's the same with biochemistry as well, which is why I also agree with Johannes earlier. He said to go ahead and start reviewing stuff from Biochemistry 1, because even if your question is more, let's say, clinical, because it's, let's say, a topic from Biochemistry 2, it's entirely possible that you could be talking about, I don't exactly remember the question, so I'm really sorry, but you could be talking about, let's say, diabetes, and then all of a sudden they go back and ask you about glycolysis. And if you're unable to give details about glycolysis, for example, that is grounds for failure, even if it was not your original question, even if it was not, you know, the question that you drew from the topic. So definitely make sure that you understand the topics, because if the examiners sense that you are just sort of reciting some information that you memorized and that you don't actually understand what you're saying, they will start asking, and they'll keep going deeper and deeper and deeper into really the basics until, you know, if you're unable to answer, then it's an automatic fail. I also wanted to mention one more thing about micro. I know that microbiology was actually several minutes ago, but I just wanted to emphasize the fact that microbiology does not make sense. I'm sorry. Physiology, when you're studying physiology, you know, even, you know, it's not about memorizing, but you can probably find some logic in there. You start going, oh yeah, that makes sense. I've experienced that. Oh yeah, that's cool. I've seen that before. But when you're studying microbiology, I mean, you're studying organisms that have evolved separately from humans. They don't really make very much sense. And definitely, unfortunately, I would say that microbiology is probably a little bit less about understanding and maybe a little bit more of the memorization. So maybe that one is a little bit of an exception to the rule. But just to warn you that if you're trying to find logic in microbiology, you probably won't. It doesn't make that much sense. It's a lot of information and it's really difficult to organize, but Sketchy Micro, like Johannes said earlier, is really good at sort of summarizing the information in a visual way so that you can remember lots of information that would otherwise be difficult to sort of connect together. That's all I wanted to say for now, and go on.
Yeah, and so we were talking about how in physiology, the fact that you need to understand everything is a lot more important. So what do you actually need to be doing in order to understand? Like I said, when I take my notes, I'm a note taker. When I take my notes for physiology, a lot of sources and familiarize yourself with the content. I think it's vital to start with videos. I think videos are like the least amount of like, how'd you put it? Like an activation energy, if you will. Like you don't need to put that much effort into it. It's kind of passive, and then you fall into the video, and then you start understanding certain things. Rewatch it, and then you learn more. And it takes what, maybe 20 minutes. There's some Ninja Nerds videos that I put on repeat so many times during physiology. Can't express how important that YouTube channel was for me during passing physiology. So yeah, videos, and also our MIMSA lectures. The reason why, you know, this isn't just about saying, hey, look, guess what we're doing? We're doing these lectures. Come. This isn't just me trying to get you guys to come. This is like, you know, these seniors, these teachers, we've gone through the subject. We know what the examiners want to hear, so we're gonna do our best of hopefully to kind of get you guys to understand the basic concepts of each of the lectures. And so that's why I think it's really important to attend these lectures. And obviously, the more you participate with us, the more you tell us, hey, actually, Ashwin, your electrophysiology lecture, it wasn't great. I'm sorry. Please, can someone else do it? Or please, can you do it a different way? And so I can know. So that's why your feedback is really important to us. Or if later on, if Johannes's lecture was outstanding, you completely understood renal physiology and you managed to pass your test because of it, you might want to give us a nice feedback, and we'll use that as an example for our future lectures. So the more you participate, I think the more these MIMSA lectures will be useful for you. And also I'd like to add, we do the MIMSA lectures for anatomy too. So if anyone in our audience considers themselves somewhat of an expert, or like you just enjoy teaching, or there's a certain topic in anatomy where you think, yeah, I know that off the back of my hand, I still remember everything, and I can, be useful, and it can be useful for people in first year right now. I think definitely sign up. I'll put in a link at the Google Forms now so you can sign up. But yeah, that's it from me with the physiology. You can move on to the next slide.
Would you like me to talk about this?
Oh yeah, sorry. Yeah.
No problem. Okay, so you know what, we threw this in here for the sake of completion, but you guys, I believe half of you guys should have had nursing last semester. And later on after this, I will talk about the vacational training that you have this summer. So just for the sake of completion, nursing, I hope that you guys have this in person, at least the practical parts, but you'll be, if you guys haven't had nursing already, just to kind of fill you in, you'll get to learn a little bit about nursing theory. You'll learn about, some basic patient care, like for example, prevention of bed sores and things like this, bandaging, taking blood pressure. And then you should be able to go to the hospital later if they're still allowing this, and you'll be able to practice changing beds and maybe possibly washing a patient, so assisting with hygiene. And I believe there should be also a portion in which you get to practice drawing blood from each other, which is quite a lot of fun, but maybe not so fun for people who are afraid of needles. But that's a lot of fun. And just to sort of plug as well that we actually have blood taking sessions, if you guys are interested. So MIMSA runs blood taking sessions, I believe, every Wednesday and Thursday, if I'm not mistaken. So if you guys find yourselves, if you guys really like pricking each other with needles, definitely sign up for the MIMSA blood taking sessions, and you can have you'll have a supervised nurse helping you and teaching you how to draw blood, so you get to have more experience if you want. So that's it for nursing. The last part that I wanted to talk about is your vacational training. So you should have noticed that this is one of the other new courses that you have this semester. So basically, starting from second year, every single summer, you will have a different internship that you should complete during the summer. For second year, it is nursing. For third year, it would be primary care. For fourth year, it would be surgery and internal medicine. And then for fifth year, it would be obstetrics and gynecology. So, but, just to sort of show you how it progresses. But in any case, for this summer, you are asked to do a summer nursing internship. What this means is that you are supposed to complete roughly 60 hours within 2 weeks of practical nursing training under the supervision of a nurse. You can actually do this internship either here in Czech Republic, or you can do it in your home country. But I would like to sort of mention the fact that not all countries will allow international medical students to handle and touch patients. For one reason or other, some countries have really strict privacy laws. So, for example, they're unable to excuse me, sorry. So they're not able to legally access the facilities and work with patients. And the whole point of this training is that you actually get some hands-on training. Personally, I did my training here in Brno, and it was actually quite a bit of fun. I did it at the Bohunica hospital, and I got to prepare medications. I got to draw blood. I got to, well, maybe this wasn't so fun, but I changed a couple of colostomy bags and a couple of urine bags. But it's fun because like we said earlier, when you're in your preclinical years, you're doing a lot of just studying and theoretical studying. So it's actually quite fun to be finally in the hospital and to be able to actually do stuff. So in any case, you should, if you want to do the training in your own home country, then you need to go ahead and check out whatever the regulations are for your country. I have heard that Spain does not allow foreign medical students to touch patients. So if you're from Spain, just throwing that out there, but maybe if you find like a private clinic or something, maybe it might be possible. I don't know any other countries off the top of my head, but I know that from EU that definitely Spain does not allow it. In the handout, there is a link to the Faculty of Medicine website, and there are some forms there for the vacational trainings. You need to go ahead and, well, rather, when you're doing the training, you need to complete the form, and in order to receive credit for the course, the form needs to be signed by your supervisor, and it needs to be submitted right now because of the pandemic online. You can upload it to the Homework Vault, and that's how you would receive credit for this. I wanted to mention one more thing about this vacational training in case you want to do it here in Brno. I see someone has their hand raised. I am almost finished, so if that's okay, I'll let you ask your question as soon as I'm done with this. But the practical training can be done here in Brno. For this particular training, the vacational training in nursing, the study office is actually able to help you find a nursing supervisor here in Brno. This is actually the only training that the study office helps you with, but they're able to provide you with contacts so that you can find a nurse who's willing to watch over you in the hospitals here, and you can go ahead and get that done here. So if you want to do it here in Brno, you can go ahead and contact the study office and they will give you contact information for a nursing supervisor. Otherwise, from years 3 onwards, it is individually arranged. You need to contact whichever doctor, whichever facility you want to do it at. So regardless of whether it's done here in Czech Republic or whether it's done in your home country. So I just wanted to mention that because it's convenient that for this year, if you want, you can ask the study office to help find you some contacts so that you can do it here. And do you guys have anything that you want to add?
Nothing that I can think of. I think we can get to the question part.
Okay, sure. Yeah. So thank you guys for your attention. And if you have any questions, then we will field those now. So I saw that, I don't know who it was. Someone had their hand raised earlier.
Yeah, so about the vacational training, if we want to do it in another country, do we have to get that approved first or something? Like from the study office, I guess?
No, not at all. If you want to do it in a different country, all you need to do is just complete the form. It's in the link to the forms is in the handout for all the forms, actually for all the years. So you just download the one that's for second year, the nursing training, and then you just have it filled out. There's like a, I think on the very last page, there's like a little, there's an area for like the signature of your supervisor. And I think like maybe some sort of, I don't know, they're crazy about stamps here. So I think there's like even a spot for like a stamp. So like if there's like an official stamp for the facility that you were at or something, but I mean, I don't know. I think that's just here. They're really crazy about stamps here. So.
Okay, thanks.
Any other questions?
Yeah, go ahead, Masab.
I'm one of the unlucky students who have multiple final exams this semester, like anatomy, histology, and whatnot. And in the beginning, you guys mentioned like you can not enroll for physiology. Can you explain that again? Because I came in late and I was, I want to understand it better if you guys don't mind.
Okay, sure. Dennis, did you want to start that off?
Okay. Basically, if you go to on the IS, if you go to student, start of the semester, and course selection, then you can click at the right-hand column. You can select unenroll from a subject, assuming that's still available. If that's not available, contact the study office. The reason why I would advise people to consider this is because this is something that if you have friends who, for example, failed biophysics or biology in the first semester, that you are starting to accumulate like a backlog of exams that are all going to accumulate at some point. And the problem with that is First of all, if you have physiology, biochemistry, histology, and anatomy, this examination period, it is virtually impossible to take all of them, or at least take your first attempt for all of them. So you're automatically going to lose an attempt for one of them, okay? Passing histology and passing anatomy should be your utmost priority. That means for the people that have anatomy and histology, the likelihood that they're actually going to be able to take their first attempt for biochemistry and physiology is quite low. They might be able to squeeze in biochemistry, squeezing in physiology is a bit more difficult. So that means you're going to lose one attempt of physiology already. Now, if all goes well and you pass anatomy in the summer, then life is good. But the thing is, the backlog is still there, and you're going to be forced to take physiology and biochemistry in the winter. Some people manage to take both in the winter and are fine with it. They're going to have 2 attempts in the winter and they might squeeze it through. But if you still have a backlog, then, for example, with histology, because that is what happens quite frequently, is that people take anatomy in the summer, but do not manage to take histology. They take histology in the winter, but do not manage to take anything else. Then you're going to lose all 3 first attempts for biochemistry, physiology. You're going to lose all of them. And you'll be going to your first attempt for these subjects a year after, but automatically on your 4th. And passing both subjects on your 4th attempt puts a lot more pressure on you. It is easier if you unenroll from physiology, for example, and just focus on biochemistry. The thing is, if you don't manage to pass histology on time, you're going to lose a year either way. So if you lose a year either way, it doesn't matter whether you're going to take physiology practices now or a year after. But having that pressure on the shoulders of having to take both biochemistry and physiology on your 4th attempt and making sure you pass them, that is something that I wouldn't recommend to anybody. So in case you're one of those people that still has these exams due, and you are not able to create a study plan that manages to fit all of these exams in the foreseeable future, then I would highly recommend unenrolling from physiology lecture and practice and seminars. And yeah, Michelle, you have a question, go on.
Yes, does that mean that we unenroll from only physiology lecture or the seminars and practices?
I would unenroll from all of physiology too. That way, you're not going to be losing attempts for the physiology examination. And also, you're going to have more time on your hands for anatomy and for histology. So I would, it is just time cleared out of your schedule, and there's one less exam to worry about.
Okay, but isn't it possible to get credits for seminar and practices now and then do the final later, like a year later, or is that not a good idea?
Well, you can. However, it is actually quite helpful to have the practices and seminars in the same year as you take your final examination, because as we mentioned before, the practices and the seminars are crucial to understand what the examiner actually wants from you during the examination. Like during the practice, you're going to be familiarized with what the examiners are looking for, what kind of diagrams, what kind of information they want to hear from you, and having them closer to your exam, I think I would recommend that. So I would supplement practices and seminars with additional voluntary courses like language courses, sports courses, and try to attain your credits that way.
Okay, thank you.
As for those people who did anatomy, managed to pass anatomy this winter or and didn't manage to get histology done, that's a little bit different. I wouldn't advise you guys to unenroll from physio. I do think it's a little bit more possible to do the 3 exams this summer, especially if you consider doing one of them in the extended summer examination period. I would advise you do histology and biochemistry first. I really don't think, I mean, if you have histology still, I think definitely get it done first. But biochem, if you have just biochem and physio, I did biochem first. I think it was useful to have some kind of biochem knowledge for physio. I don't think you can use that much physio knowledge for biochem, so it really depends. Or if you're that kind of mentality where, oh no, I want to get the hardest one done out the way, then go for it. I don't think it should matter too much which one you do first, but that's the way I did it. I did biochem first and then physio.
Personally, I would also recommend doing biochemistry first, simply because passing biochemistry actually allows you into more courses than passing physio does. If I go back to the prerequisite slide, I believe, if I'm not mistaken. Sorry, guys. Yeah, so let's say, for example, you don't manage to pass physiology this summer, but you manage to pass biochemistry. Well, you have physiology, you can do it in the winter. I mean, obviously, hopefully you can handle it in the winter, and then you would be able to enroll in immunology for the next semester. But biochemistry 2 is needed for microbiology 2 lecture, for example, whereas physio is not a requirement for microbiology 2 lecture. And then also, for example, pathophysiology 1, you can enroll with either physiology or biochemistry. So I mean, if you're just simply weighing it out, I think that biochemistry, getting that out of the way and passing that might be slight. I mean, I don't want to say more important, because obviously all of the courses are important, but if you're struggling a bit with physio and let's say you've already taken your first attempt and it didn't go well and you're trying to save physio for the winter or something, then definitely try and at least pass biochem.
Yeah, fitness. Yeah, go ahead, Mahad.
I think I heard one of you mention that if you pass everything but physiology, you're still technically on track.
Yeah,
That is correct.
That is correct. Yeah, because if you don't pass physiology for second year in time for third year, I think the only thing that you'll be missing from that semester is immunology, if I'm not mistaken. And it's okay if you're a year behind for immunology. You can do it in my year and then continue, and they will move around the blocks for you, and it's not going to be too much of a problem. So, yeah.
No, I'm sorry, that's not entirely correct. You need physiology 2 for pathophysiology 2.
Oh, for the summer semester, right?
Summer semester.
Yes, for the
spring
summer
semester of the
Yes,
third year.
yes.
But that means
But I
you
think
can theoretically take physiology in the winter examination period and still be on track.
Yes, like it's okay if you don't pass it in the summer, but try and pass it in the winter if you have it, because then you'll still be on track with that. But if you don't manage to pass it in the winter and you have to re-enroll into as a repeat into physiology 2, then yes, you would be behind. Immunology, or not being able to take immunology, is not really that big of a deal, because yes, you can take it the next year. I believe that it will preclude enrollment only for like I think for fourth year. So, well, let me think. I think for infectious diseases or something, but that can be done. Like, for example, right? I believe that immunology is done in the autumn semester. And the way, like, once you get to the clinical years, actually half the year rotates. So you have the coursework for the whole year, but half of it is rotating. So, like, for example, what Ashwin had last semester is not the same as what I had last semester. But what I have this semester is what Ashwin had last semester. So if you don't manage to do immunology in third year, you can technically do it in the fall semester of fourth year, and it's fine, because of the way these courses rotate, the prerequisites that you would need immunology for can be done actually in the spring instead of in the fall at the same time as, well, you wouldn't be able to enroll because you don't have any immunology. But I hope that makes sense. I'm sorry, I'm not so eloquent sometimes, but hopefully that made sense.
So let's say I unenroll from physio right now. Does that obviously means I cannot take the physio final exam in the winter semester next semester? And then
no, you cannot. You cannot.
Which then means I can't do pathophysiology on time.
Yes, that is true. However, if you do not manage to, for example, take histo, well, if you have anatomy and histo, which I presume you do, if passing histo for anatomy is unusual, if you do not manage to take histo in the same examination period, it will put you a year behind already. So it doesn't matter whether you're going to have physiology this semester or not, because you'll still lose a year either way.
Right, okay.
Histology needs to be passed during the summer in order to avoid re-enrolling as a repeat student in the autumn semester. Like, yes,
so
you would still have your fourth and fifth attempt, but that would put you behind a year.
Yeah, essentially, we're just giving you a little bit of a strategy in order to not get you kicked out. So if you are in this difficult situation that you are in, this would be, I'd say, that highly advised that you do this, because it's not common that a lot of people pass all four. In fact, barely anyone does. So yeah.
All right, thanks a lot.
Right, thanks for the question. if there's no any other questions, I think we can think about wrapping up. Yeah. Of course, if you do have any questions and you'd like to ask us privately, feel free to message any one of us. We'll have lectures throughout the thing. Please attend. I think you'll find them useful. In fact, I can go as far as to saying if there is one bad feedback in the feedback form, I will resign. So yeah, so thank you for coming up. It's been a great turnout for this event. I'm really surprised. So yeah, thank you very much for coming up and
Thank you.
showing up. Yeah.
Thank you.
All right. Bye guys.